Hello everyone, I'm Jon Salmanton-García from the University Hospital of Cologne, and today we'll speak about the current state of laboratory mycology in Europe and beyond, specifically about diagnostics and treatment capacity. These are my conflicts of interest. As many of us know, there are certain type of patients that are at a higher risk for invasive fungal infections, and this might depend on the different geographical settings. For example, we have the patients with HIV or AIDS, patients admitted in ICU units, patients with malignancies, either hematological malignancies or solid tumors, patients with uncontrolled diabetes mellitus, and in the last years, it's becoming more relevant, the number of patients with viral respiratory infections and then invasive fungal infections. For example, patients with influenza or SARS-CoV-2. In our research, we had the objective to decipher which is the current diagnostic capacity and availability of treatments, and then in order we wanted to guide professional or health professionals, patients, and also policymakers. This we did with an online registry. You can see the link in the lower part of the slide, and you can even scan the QR code and participate. And the first thing we did was to contact our different collaborators from different hospitals, from the ECMM, the European Confederation for Medical Mycology, and the ISHAM, the International Society for Human and Animal Mycology. Then we look for researchers working with invasive fungal infections in different online search engines, like, for example, Google Scholar, PubMed, ScienceDirect, or clinicaltrials.gov. And finally, we also promoted the link in different social media like LinkedIn and Twitter. The starting point of this whole research was a publication from 129 sites in 24 countries in Caribbean and Latin America. Then the same research was developed in other geographical settings, such as Africa, Eastern and Southeastern Europe, the whole Europe, and finally, last but not least, in Asia and the Pacific. The first part of the questionnaire was about the incidence of invasive fungal infections. And there we could observe how in the Caribbean and Latin America, Europe and Asia Pacific, most of the sites call it as moderate, the incidence perception. However, there were some institutions, especially in Asia Pacific, that found the IFI incidence high or very high in their local settings. And regarding the most frequent pathogens, both, or actually in all the continents, Candida was the most relevant one. However, if we were focusing on the second most relevant pathogen, we could see Caribbean and Latin America and Africa on one side with Cryptococcus species, and on the other side, Europe and Asia Pacific with Aspergillus. And if we focus on the more rare pathogens, we could see how Mucorales was considered more relevant both in Europe and Asia Pacific than Fusarium. In the second part of the questionnaire, we ask about the diagnostics. Regarding microscopy, we can observe how in almost every European and Asian Pacific site, it was possible to perform and to run this test, and in Africa, in a bit more than 50% of the sites. And when we ask specifically how frequently do you use microscopy whenever you suspect there is an invasive fungal infection, in more than half of the sites, they were replying that more than, well, I mean, like always. Regarding the culture and fungal identification, this was possible to perform in almost all European and Asian Pacific sites, and in Africa and in the Caribbean and Latin American, between 70 and 80% of the analyzed laboratories. And when we were asking specifically about the possibility to run susceptibility tests in all the geographical settings, it was possible to run them in more than 50%. And if we look for the European and Asian Pacific results, it's close to all the analyzed labs. Regarding serology, this is more frequently available in Europe and in Asia Pacific. In Europe, a bit more than 80% of the sites. In Asia Pacific, a bit more than 60% of the sites. And if we look for the results from Africa and the Caribbean and Latin America, these numbers are around the 50%. Regarding antigen detection, this is pretty important for the diagnosis of certain invasive fungal infections, for example, aspergillosis. In Europe, we have the highest levels, close to 90%, and almost in all the sites, it's possible to run at least one antigen test for the detection of aspergillus. And then we have similar values for the rest of the geographical regions. In all the cases, it's around 70 to 80%, and the most common antigen test is for Cryptococcus. In Asia Pacific, also for Aspergillus. And last but not least, regarding the diagnostic tests, we have the PCR and other molecular tests. In Europe, it's possible to run it in more than 80% of the analyzed sites. In Asia Pacific, in more than 60%. And then if we focus in the Caribbean and Latin America or in Africa, the levels go down up to 40%. And the final section of our questionnaire was regarding the accessibility to antifungal drugs. We start with amphotericin B, flucytosine, and terbinafine, and specifically about liposomal amphotericin B. In Europe, we find the highest availability. Close to 80% of the analyzed centers could provide liposomal amphotericin B to their patients. Then we have the Caribbean and Latin American and the Asian centers with a possibility to give liposomal amphotericin B in between 50 and 60% of the sites. And then we have Africa with less than 20% of the clinics with this option. If we look also for the data regarding flucytosine and terbinafine, we see that terbinafine, for instance, it's only available in more than 50% of the African, European, and Asian Pacific sites. Not really regarding Caribbean and Latin America, we don't have such data. And for flucytosine, only in Europe is available in more than 50% of the sites. Regarding echinocandins, this might be available in 90% of the European sites and in 70% of the analyzed Asian and Pacific institutions. And when we move to the Caribbean and Latin America and to Africa, the availability varies between 20 and 40%. And finally, regarding triazoles, we can see that there is at least one triazole available in 90% of the all analyzed sites, regardless of the geographical distribution. However, when we look for mold-active triazoles, these numbers change. And we have different results depending on the geographical setting. For example, in the Caribbean and Latin America and in Africa, the most commonly available mold-active triazole is itraconazole, and it goes between 70% and 50%. And in Europe and Asia Pacific, we have voriconazole, and the levels are much higher, between 90 and 80%. And now with these stars, we can see the results for the newest triazoles. With the red star, the results for posaconazole, that we can see that in Europe it's almost available in 80% of the sites, in Asia in 50%, and if we go to Caribbean and Latin America and Africa, the levels are below 20%, and isavuconazole, the newest one. In Europe, 60% of option to provide it to the patients, in Asia Pacific in the 30%, and in Caribbean and Latin America and in Africa, it's almost impossible to find this new triazole in any of the analyzed institutions. And last but not least, we have the therapeutic drug monitoring, which is pretty useful to measure the levels of the antifungals we are providing to our patients. And we can see in Europe and in Asia how there is at least availability to run therapeutic drug monitoring for at least one drug in more than 60% of the European sites, and always for voriconazole, in Asia Pacific in around 50% of the sites, and always also for voriconazole. In Caribbean and Africa, these numbers are much more reduced. In the Caribbean and Latin America, the possibility is mainly for voriconazole, and in Africa for itraconazole. And with this, we come to conclusions. We have separated conclusions depending on the geographical setting. For Caribbean and Latin America, the first one is that there is a lack of diagnostic tools, and this is quite a problem, and we have a worrisome low number of antifungals available, and we are speaking about an endemic region, which means that the results are even more important. For Africa, there is an urgent need to improve laboratory capacities, also a need for an effort in non-HIV patients. Same as in the Caribbean and Latin America, there is a lack of access to most expensive techniques, and we are speaking also about an endemic region. In the case of Europe, the situation changes slightly because we have acceptable access to IFI diagnostic and treatment, and however, there are substantial differences based on macroeconomic situation of the country, with some countries that, even if they are in Europe, might have levels of other latitudes and longitudes. And for Asia and the Pacific, we can see a similar thing as in Europe. There is an heterogeneity, access to diagnostics and treatment tools based on the respective country, and therefore inter and intra-regional collaboration is necessary. And in this case, we are also speaking about a region with endemic invasive fungal infections. Last but not least, I would like to give some acknowledgements to the authors of the respective publications, Caribbean and Latin America, published in Mycosis in 2019, the African publication, available in Lancet Microbe from 2022, the European one, and also the Asian Pacific ones. And special thanks to all the authors, because I had the enormous pleasure to lead and to manage this research. The European one, it's available in Lancet Microbe, and the Asia Pacific one will be available soon. Thank you very much, and see you next time.